So at the SOHO meeting this year, I had the opportunity to present on immunotherapeutic options for patients who have relapsed mantle cell lymphoma and who experience disease progression on a BTK inhibitor. So we know that in general, BTK inhibitors are a very effective treatment option for patients with relapsed disease. But unfortunately, most patients on a BTK inhibitor will ultimately experience disease progression, usually between 1.5 and 2.5 years after starting the treatment. And historically, those patients have had a very poor prognosis with early progression and unfortunately early mortality with an overall survival less than 1 year. Fortunately, in the current era, we now have a number of options, including several immunotherapies which are available or are currently in development. The most commonly utilized therapy is CAR T treatment. There is one currently approved CAR T product, Brexucabtagene autoleucel, which targets CD19 and is highly effective in patients with relapsed mantle cell lymphoma, including those that have progressed on a BTK inhibitor. And what we've now seen with prolonged follow-up is that even after now 3 years of follow-up, patients who achieve a complete response, which fortunately is the majority of patients, are enjoying prolonged remission of several years. Now, it's still too early to know whether those patients will be cured, but compared to the outcomes for patients post-BTK prior to the availability of CAR T therapy, it's a dramatic improvement. In addition to Brexucabtagene autoleucel, there are other CAR T products that are currently being evaluated, including conventional CD19-directed CAR T, as well as some CAR T therapies that have multiple targets. I also had the opportunity to discuss the emergence of antibodies, as well as an antibody-drug conjugate targeting ROR1, which is expressed on mantle cell lymphoma cells. This therapy appears to be very effective, as well as very safe and tolerable. And although the trials of zilovertamab and zilovertamab vedotin are still ongoing, these are very encouraging findings and certainly may be a consideration for those patients who are not eligible for CAR T. Finally, I think it's important to recognize that the bispecific antibodies are emerging across the lymphoma landscape. The data for mantle cell lymphoma is a little bit more, the data for mantle cell lymphoma are a little bit more limited at this stage, but we did have some early data from ASH last year, which are highly encouraging. And so I also think that there will be opportunities in the future for patients to access bispecific antibodies, either after they progress after CAR T or if they're ineligible for CAR T therapy.